Happy Wednesday, ReMar nurses. This is our middle of the week check-in. We're going to be talking about some NCLEX stuff, but as you can tell, I'm not in the studio that I typically am in because I am traveling. Your girl is traveling. I actually love to travel. How many people from the ReMar community just love to travel? It's how you learn, it's how you relax, it's how you take the opportunity to do things that you normally wouldn't do in your hometown. That is me. And nursing opened up my world when I finally got my license. You know that when I grew up, I did not have a lot of money. I came from a single mother that worked really, really hard just to provide the basics for myself and my brother. So I was not accustomed to traveling growing up. I literally stayed in one place all the time. And so when I became a nurse, I actually started travel nursing. And that was such a unique experience for me because not only was I able to practice doing what I loved when I wanted to do it, uh, then the company paid for everything. Like when you become a travel nurse, I'm just putting a bug in your ear. After you get your license and you get your experience, some of you may be interested in traveling. And so I know a good travel job when I see one. And I took the opportunity to do travel nursing. So I would fly to California, I would fly to Minnesota, I would fly, and the company, like I said, they were paying for it. They were paying for flight, they were paying for car, they were paying for hotel. I got like $40 to $50 a day for food. Y'all just don't know. When I'm encouraging you to pass this NCLEX, I'm doing it so that you can take it to the next level. Okay. Take it to the next level. So once I got that traveling bug, I'm like, man, I love it. I love this. I love working for, 13 weeks and then not having to work again for 2-3 months. So I would work for the summer and then I would take the holidays off. So I never worked Thanksgiving, Christmas, New Year's. Like I always like to be available for my family. So let's get studying because many of you love to travel and you're just not doing enough traveling. You're just not doing enough right now. And you want to travel with yourself and your family. So we're going to talk about a topic that, of course, is going to be on that NCLEX exam. And I love to give out information, but I always say that we need to have a place to put what we're learning. So this presentation belongs with your V2 materials. In the medication administration lecture, somebody put that page on the screen for me. In med administration lecture in your blue workbook, the student workbook, we talk about giving medications through a G tube. So gastrostomy tube care is essential. It's essential, whether you're a registered nurse or a practical nurse. My focus today is not to go over the things that I talk about in the V2, but to position you so that when you are reviewing this topic, you come from the right background and understanding in case you missed this in nursing school. Gastrostomy tubes are important because when your patient is not able to eat naturally through their mouth, we have to find an alternate way to feed them. And normally, if a person is not eating, through their mouth for whatever reason, and we need to feed them on a short-term basis, how do we do that in nursing? If we need to just put food down, if we need to put medication down in our patient, and we know we're not going to do it for a long time, what's the best way to do it? What is the best way to get to that, enteral location for a short-term basis? Bingo. We're going to put down a nasal gastric tube. Hi, come on in. We're studying. We're going to put down a nasal gastric tube. NG tubes, quick. RNs, PNs, put them down. And we know that we can get that solution that we're trying to deliver to our patient. However, nasal gastric tubes are not for long-term use because that tube is going to begin to break down the nose, break down the nasal passages if it stays in place too long. NG tubes are heavy, right? They are, they're irritating. So we have to find another way to feed a patient long term. This is where gastrostomy tubes come into play. Also, the idea is for NCLEX is you got to know how they're placed and how to take care of them. So let's get into them. Plus the different types of them. Let me not skip that part. And for me in nursing school, it was really tough. I was sitting in my med surg lecture. I'm like, huh? What? This doesn't make sense to me in the same way. So let me ReMar this thing. We're talking about gastrostomy care. These are feeding tubes, okay? Like I said, just like your NG tube, however, for long-term basis. So they are going to be placed either surgically, they're going to be placed endoscopically. If we say something is placed endoscopically, what does that mean? You should know that that's a clinical term and it is very important for positions. So it's placed surgically, endoscopically, or radiographically. Okay. Now, these require a surgical operation. So think about the pre-nursing things that are done before surgery. You got to do a consent. Your patient got to be NPO, right? They have to have certain health conditions to qualify for this operation. It's a serious thing. And what happens is in the surgical procedure, they are getting a feeding tube inserted through the skin into the stomach, okay? This is a long-term feeding option. And so as you can kind of see here, the positioning of that tube, when you are handling it, you're going to be handling the outer portion, but there's an inner portion of that tube that's going through the skin directly into the stomach. This is very helpful for certain types of patients. And again, so you have here an enterostomal tube. I put this as a secondary slide because what we call that opening, what we are caring for is that stoma, okay? And that is allowing that tube to stay in place and also go to where it is supposed to go. If you have a different type of tube, maybe you don't have a G tube, maybe you have a J tube. A J tube is not going into the stomach, but usually when nursing students are introduced to gastrostomy tubes, a J tube is also flexed or mentioned in that lecture. That is going into the jejunum, which is in the small intestine. Okay, so that's a tube going directly into the small intestine, but it works the same way. You're going to be putting food and things like that in that J tube. Surgical placement was one of the references of how these tubes are inserted. And you could either do a very traditional approach where the surgeon is splitting the midline of the patient and looking at the stomach and making sure that they are directly putting that tube into the stomach. So your patient will have a midline incision. Or there's, of course, the easy laparoscopic way where they're going to have a smaller opening that is more straightforward in midline and requires less of the tearing of the outer portion of the skin. And so I have here surgical gastrostomy tubes can be carried out either laparoscopically using an open approach, or an open insertion of a gastrostomy tube involves the creation of a midline incision. So that is what that means. When we are talking about the two major tubes on NCLEX, it'll be what's the difference between a gastrostomy tube and a PEG tube. Have you ever heard in nursing school or nursing lecture, oh, the patient has a PEG tube, right? And you sit there and you're like, okay, we write down just PEG tube. You don't want to ask because you don't want to seem like you don't know anything or you missed something important. Here, it's okay if you don't ask because I'm going to define it for you. So let's talk about just the traditional surgical gastrostomy tube. This is where your patient is in the OR. It takes about 30 to 45 minutes. It's done under anesthesia. So either it's going to be done laparoscopically or your patient's midline is going to be cut open and that tube is going to be placed. Okay. The PEG tube is going to end up in the stomach in the same way, except for we're not creating a midline incision. We're not doing it laparoscopically. The PEG tube stands for percutaneous endoscopic gastrostomy. Okay. And that means essentially it's going down the throat. It's going down the throat of your patient, and it can be done under general anesthesia, and it is less expensive. All right. And it is more time efficient. So if you have to have this done very quickly, you can do it with a PEG tube. And so for NCLEX, it is very important to know that major difference. And it's just the little things. But guess what does it? Content review. Just sitting down and just hearing about the subject before you begin to answer questions. Because now you know the difference between a regular G tube and specifically the PEG tube. So whether your patient has a G tube or a PEG tube or a J tube, these are some of the reasons why. Again, long-term nutritional support. If you need to get access to the stomach for medication delivery, this is a great way to do it because those tubes end up directly into the stomach. If the patient possibly has a bowel obstruction, then a J tube might be more suitable for the patient. Or if there's any gastrointestinal or biliary interventions that need to take place, this intervention, this treatment is going to allow you and the doctors to do that. Now, very quickly, I want to just address the care of the G tubes because nurses are able to change G tubes when it comes to providing care for these tubes. All right. So you have to understand why your patient has them, what you can do with them, when you can do stuff with them. And then if there is a reason for changing it at all, the nurses would change the G tubes. Now, the J tubes, the nurses are not going to be changing those. Those are directly into, like I said, the small intestine. You're going to have a physician do that. People who do not need to get any kind of J tubes or G tubes are going to be patients with gastric varices, any recent abdominal surgeries. If your patient is morbidly obese, it may be difficult to get a great placement. Patients who are pregnant, of course. And then if your patient has ascites, if they have any kind of indication that their abdomen is not in a normal condition to receive constant, I want to say like constant manipulation. Okay, that's the word I was looking for, by any kind of medical treatments or interventions. This would not be the patient to put a G tube in. And again, remember, gastrostomy tubes are challenging because you have to understand for NCLEX how they can be placed. So is it endoscopically? Is it going down the throat? Is it radiographically, meaning you're using a kind of like a CT, you're using an intervention, a diagnostic intervention to make sure it's placed in the right way? Is it surgically placed? Or is it a replacement tube that the nurses are actually doing themselves? Tube dysfunctions, of course, we can't look at an intervention without looking at the emergencies or the complications for NCLEX. So a tube dysfunction complication would be if there's clogging of that tube, if there is a tube deterioration, or if that tube, most G tubes are held in place with a balloon that is filled with sterile water. If that balloon becomes deflated, and then that can change the positioning of the tube. It's like when we have an indwelling catheter, we secure indwelling catheters with a balloon to stay in place. And so when that balloon is not manipulated or it is deflated, then you have a complication. Tube feeding complications. Well, we have aspiration, okay, diarrhea, if there's any kind of metabolic changes. And for NCLEX, metabolic changes would be hyperglycemia, okay, if there's any kind of micronutrient deficiencies, or if there is refeeding syndrome. Refeeding syndrome. Patients can also be constipated. They can also have infections at that stomal site. We should know what an infection looks like for an stoma, how to care for a stoma, which is normally we're going to be caring for a stoma like we do regular skin. However, after a surgery, we have to treat it like a surgical wound, okay, right after a surgery. We have also here what bleeding, peristomal leaking, if there's any ulcerations, what would cause an ulcer to develop? What would cause an ulcer to develop for a G tube? Think about that. Think about ulcerations when we're talking about them. Normally, we're talking about pressure ulcers, right? Yeah, dermal pressure ulcers. Gastric outlet obstruction, and this is bad, leakage of gastric content into the peritoneal cavity. It's possible. So these patients, although you can see them on a general med surg floor, you can have these patients in long-term care facilities or rehab facilities, whether they're adults or pediatrics. A lot of pediatric patients have G tubes if you're working with that population. So even though they may have these on very basic units, the care for this type of medical intervention requires the highest level of skill to meet, because there are certain complications that can severely impact the quality of life and the health and well-being of the patient. All right, so again, this is a quick review, but the deep diving that you're doing, and I hope that everyone is staying consistent in their studying with the V2 program. This specific topic comes from medication administration. You are pairing the blue book here with the lectures. So medication administration is actually a video that you're going to be watching. Good thing is, it's not long. How many people know how long that video is? But it is necessary. Not long, but necessary in part of your content review. If you just have the Quick Facts book, and I love Quick Facts, you guys know I take it with me everywhere. Here it is. I had it in my laptop bag. So I put my laptop in with Quick Facts. Love taking Quick Facts with me. Super essential. But again, this is only half of the program. So you are only doing half of the work if you just have Quick Facts. I encourage you to get the videos with the QBank as well. I am excited to get another testimonial from a nursing student who's passed. And this is the time that I say that people are really big into vision boards. Vision boards. Like when we talk about traveling, I asked, hey, who wants to travel? When we talk about, getting access to better healthcare, better educational opportunities for your kids. Mark and I listened to a video of a woman that was just calling around looking for daycare, for half-day daycare for a toddler. And it was like $900 a week for just daycare. And so these prices of basic things are going up. And I know when you guys are thinking about your future and your vision, that you have those things in your mind. Like, I want to be able to do those things. So I want to say vision boards are great, but decision boards are even better. And if you're just casually watching ReMar videos and maybe you're just casually studying with the Quick Facts, make a decision to get the full training so that you're able to make better decisions on your NCLEX. And that is the real goal, is being able to be prepared for this exam. So visions are great, decisions are better. And as this is Winning Wednesday, the middle of the week, think about what other decisions that you need to make that you have been just thinking about for too long. Okay. There is a point of contemplation and then there's a point of stagnation. So decisions. And I'm going to help you make decisions right now because we're going to do some NCLEX questions. It's time for you to make a decision on which question is correct. Here's the first one. Here is the first one. And remember, we're talking about G tubes here. So the nurse was assigned in a medical surgical unit. From the following clients, who is highly recommended for a gastrostomy tube insertion? Here we go. Number one, a client with dysphagia secondary to stroke. Two, a client with a history of tonsillar cancer. Number three, a client on 3 days post-operative partial laryngectomy. Or four, a client with a recent diagnosis of Hirschberg's disease. Here we go. Who is going to be the client for this G tube? Who's most appropriate? Are you going to go with 1, 2, 3, or 4? And think about what we just talked about in class about G tubes. The correct answer, I hope you got this one right, is number one, clients who have been having dysphagia for more than 3 weeks. And this is common secondary to a stroke. Patients who have stroke issues, these would be highly beneficial to have a gastrostomy tube put in place to prevent aspiration without sacrificing for nutrition. So remember, G tubes are for long-term feeding replacements, not the same as an NG tube. That's a huge point you have to remember, in addition to knowing the difference between a G tube and a PEG tube, which we went over to class. So yay for you for coming to class. We're going to pass this NCLEX test. We're going to pass this NCLEX test together, but you got to show up to class. All right, I'm moving on. Question number 2 is this. The nurse cares for a client with a surgical gastrostomy tube. Identify the best nursing action for the client's routine of gastrostomy care. Here we go. Number 1, initiate enteral feedings right away to prevent malnutrition. 2, add tension to the stoma to ensure balloon is in place. 3, cover the wound with a thick dressing to keep it dry always. 4, apply antibiotic ointment to the insertion site to avoid infection. What is the best option? Okay, what is the best option based off of what is in front of you? Because that's major. When you're on NCLEX, I mean, you're on it. You're taking it. It's the test day. It's real. Don't go off into your mind thinking, oh, I wish it would say this, or why doesn't it say this? Forget that. Look at what's right in front of you and say, I got to pick one of these bad boys. Which one am I going with? I hope that you pick number 4. Apply antibiotic ointment to the insertion site to avoid infection. Yes, clean wounds after surgery are still important because of risk of infection. And so with a stoma, topical antibiotics or barrier creams, all right, and barrier creams can be used to prevent infection. I'm moving on. Here's question number 3. The nurse assesses a client's gastrostomy tube for deterioration. The nurse should look out for number 1, loose fitting of the tube. 2, redness of insertion site. 3, discoloration of the tube. Or 4, client reports pain during feeding. Ooh. Which one you want to go with? This is a good one because there are a couple that you could be like, I have 2 on my mind. How do I know which one is the right answer? And this is very important because when you can get it down to 2, which most of us can, how do we know which one to go with? Well, we have to look at the question. The answer is in the question. And so if you look at the question here, the correct answer is gotta be number 3, discoloration of the tube, because we are not talking about position. We are not talking about pain. We're not talking about whether it's right or wrong. We're talking about discoloration based off of deterioration. So deterioration is what we're looking for specifically. It's looking at the tube. And so the best answer for this question is absolutely number 3. And my rationale says this: if the tube is not regularly sterilized, it can lead to faster deterioration and can cause to break and leak. Deterioration can be recognized by the presence of discoloration, irregular beating of the tube, and an unpleasant odor. So if that tube starts to change the color, the shape of it, if it begins to be mottled, or if there's an unpleasant odor, it's time to change out that tube. Okay, if you love those questions, get into the V2 question bank. There are much more waiting for you right there. I'm so glad that you showed up to class. This is an important part of the training in terms of consistency. I do these classes for free because they help you to stay on task if you're following the study calendar. But again, everything that I do comes from the V2. So do the work there. Do the work. Get in there, get out, and start traveling like me. I might see you in one of these cities, and I hope that you stop me like the other ReMar nurses and say, Professor Regina, guess what? I will, and I did. I passed NCLEX. I want that for you so much. 2024, this is the year. This is the year that ReMar nurses are doing incredibly well on the NCLEX. So you're part of the community, then you should be part of the results too. Remember, it is not your intention to fail. God made you the head and not the tail. Be blessed, everyone. Bye-bye.